Welcome to VidZet. I'm Dr. Ted Noel. Today I'm going to begin a series on the replacement plans for Obamacare other than Rand Paul's. And today our first step is with Paul Ryan's leadership plan called A Better Way. Now, supposedly this is designed to replace Obamacare with better things, but the first thing that they've done is they've larded it up with a whole bunch of things that don't really belong there. For example, they include tort reform. Now, tort reform, don't get me wrong, it's a great idea. The problem is that torts are state-level problems and properly belong at the state, not the federal government. I know there's an argument for going federal, but it's not the best one out there. Second, they promote the use of electronic medical records. I'm sorry, that's a terrible idea. EMRs have been in use for quite a number of years now, and we have very good experience to show that they are bad. The first thing they do is that they take attention away from the patient. The doc is sitting here looking at his EMR, and the patient's over there. So he's doing his thing here. On top of that, it's supposed to reduce medical errors, but the fact is that it doesn't do anything of the sort. It actually increases medical errors, and it makes medical care more expensive because people are spending more time dealing with the EMR than they did with a paper record, and with an EMR they find themselves looking at the computer, not looking at the patient, and patients suffer. Bad idea. Then they talk about wellness programs. Oh, that sounds good. We're going to do wellness programs. There's two problems with it. The first one is really simple. Why should the federal government be paying for somebody's gym membership? Because that's part of a wellness program. The second one's even bigger. Wellness programs have been shown not to have any effect on health. So why are we bothering with it? Then it talks about a stronger National Institutes of Health. Well, once again, this is a mistake because the NIH centralizes healthcare research. This really belongs in the private sector. It has no business in the federal government. As we go along to specifics that are really part of the big reform, then we have good things. Paul Ryan's plan allows interstate sale of insurance. We've talked about that before. It's a great idea. It allows competition across the whole country, and you end up with people buying plans that match what they need, not what New York or Minnesota thinks they need. Then it talks about expanding HSAs. Unfortunately, the details on the expansion are really very thin, so it's a little hard to tell what's going on. It appears that they're talking about expanding tax deductions, which, as we discussed in the prior video, are really not as good as tax credits. It allows formation of other groups for group purchase of insurance. This is exactly the same thing that Rand Paul does. It's a great idea. It lets you form a group at your church, at your Rotary Club, or whatever else. And it doesn't limit you to group policies from your employer. It also does another good thing. It prohibits companies from canceling a policy if you get sick. And it also has guaranteed renewal. Both of these points preserve the purpose of insurance, which is to protect you from expense when things get out of hand. And if the insurance company can cancel you or non-renew you, all of a sudden you're out in the cold and you bought something that's worthless. So this is a good idea. They're dealing with pre-existing conditions is apparently good, but again, there aren't very many details. It appears that what they're talking about is a one-year open enrollment program. As you will recall, Rand Paul had a 2-year open enrollment program. In the sense of trying to get people out of the federal government, I'm actually inclined to think that Paul Ryan's plan here is better than Rand Paul's because it's only a 1-year open enrollment. That is, if you've got a problem, you go ahead and you get insurance now, guaranteed issue. You can renew it next year, renew it the next year, keep going. And all of that is good. 1 year gets it out of the government a little quicker. Now, if people develop these horrible problems later on, we've already discussed that it's possible for the states to use high-risk pools, and several states have done this very effectively at very low cost, and this takes care of the problem. All in all, it's a worthy attempt. You know, as I look at this, when I talk about interstate sales, that's an A+. Expanding HSAs, I'm going to give it an A because I don't know enough details. On allowing you to form lots of groups, absolutely an A+. On no cancellation, guaranteed renewal, it's an A+. On the pre-existing conditions, I give it another A. But then when we look at all of the other bits and pieces, those are only a C. They really need to be cut out of the bill. Deal with the essentials and the rest will be taken care of by itself. I'm Dr. Ted Noel. Thanks for watching.